Alright class, this is chapter 17. It's going to be involving caring for environmental emergencies. Alright, objectives. We're going to define the following terms: anaphylaxis, conduction, convection, core temperature, drowning, evaporation, frostbite, heat cramps, heat exhaustion, heat stroke, hyperthermia, hypothermia, radiation. Objective 2. Explain the 4 ways the body loses excess heat. Number 3. Describe the signs and symptoms of a patient experiencing a heat-related emergency. Number 4. Explain the appropriate assessment and care for a patient experiencing a heat-related emergency. Number 5. Differentiate the signs and symptoms of heat stroke and heat exhaustion. Number 6. Describe the signs and symptoms of cold-related emergency. Number 7. Explain the appropriate assessment and care for a patient experiencing a cold-related emergency. Number 8. Describe the signs and symptoms of emergencies related to bites and stings. Explain the appropriate assessment and care for a patient experiencing an emergency related to a bite or a sting. Describe common factors leading to submersion injuries. Describe common methods used for water-related rescue. Explain the hazards related to water rescue. Describe the signs and symptoms of a submersion injury. Explain the appropriate care for a victim of a submersion injury. Demonstrate the ability to appropriately assess and care for a patient experiencing a heat-related emergency. Demonstrate the ability to appropriately assess and care for a patient experiencing a cold-related emergency. Demonstrate the ability to appropriately assess and care for a patient experiencing a bite or a sting emergency. Value the importance of proper training when attempting to conduct a water rescue. Temperature in the body. Temperature regulation is the process of maintaining proper body temperature. Hyperthermia, when heat gain occurs faster than body can shed heat. Hypothermia, when the body loses heat faster than it can produce heat. Radiation, body heat is eliminated into the environment. Conduction, loss of body heat through direct contact with the object of the ground. Convection, loss of body heat when air close to the skin moves away, taking body heat with us. Alright, so how would you counter the effects of each of these heat loss mechanisms? Let's give some examples. You can combat radiation by wearing a jacket or a hat. You can reduce conduction heat loss by sitting on a cushion at a football game rather than directly on the cold bench. You can reduce heat losses associated with convection by removing oneself from a breeze or putting on a windbreaker. Alright, evaporation. It's going to be a loss of body heat through evaporation of moisture in the form of sweat on the skin. Respiration. Heat leaves the body with each breath. So to combat evaporation causing heat loss, you're going to remove wet clothing, towel off sweaty skin. Respiration. You could wear a scarf or a face covering. This figure 17.1 just shows the different ways heat is lost throughout the body. I'll give you about 10 seconds to look at this slide. Alright, here's a scenario for us. It is late fall and you respond to a call for a teen who has fallen into the river after standing in his canoe. A rescue team has been dispatched. How might he lose heat while waiting for help to arrive? Alright, so think about it. He's in the water. He's going to be in direct contact with a substance that has a cooler temperature than himself, so he will lose heat through conduction. If he gets out of the water, he may lose heat through evaporation. Or he may also lose it through convection. All right, heat emergencies. All right, the core temperature of the body is 98.6 degrees Fahrenheit or 37 degrees Celsius. Heat is generated through digestion, metabolism, and movement. Heat is lost through breathing and sweating. Hypothalamus is the body's thermostat. The effects of heat loss through evaporation are greatly reduced when humidity is high. Alright, so that means if it's really hot and muggy outside, you're not going to be able to have the sweat evaporate, and it's not going to be able to pull the heat away from your body. That's why when it's very hot and muggy outside and we go running, it's just much more brutal. The very young and the very old and those with chronic illnesses are most susceptible to effects of heat and cold. You're going to perform a history and physical exam on these individuals. All right, this is just an algorithm for the emergency care of patients with a heat-related emergency. So if you have a suspected heat emergency, you're going to assess the skin. It will generally be moist. Then you're going to ask, is the patient responsive? If they are responsive, you're going to provide fluids. Then you're going to continue to monitor airway, breathing, and circulation. If you look down at the second row, you're going to see some alternatives. If you have a suspected heat injury and the skin is not moist, you're immediately going to start rapidly cooling and protect the airway and provide supplemental oxygen. After that, you're going to cool the patient, protect the airway, and provide more oxygen. Then you'll just continue on with the pathway. Heat cramps. These are going to be painful muscle spasms following strenuous activity in a hot environment, usually caused by electrolyte imbalance. Patient is going to be fully alert and sweaty with normal to warm skin temperatures. Heat cramp, emergency care. You just want to move them to a cool environment and replenish fluids, whether that be orally or by IV. Alright, so what is an electrolyte imbalance and how can it be treated? Electrolyte imbalance is going to be an issue where you have lost more fluid out of your body than you have electrolytes. This can also go the other way, where you've lost more electrolytes than fluid. You just correct this by replacing what has been lost. Heat exhaustion is going to be exposure to excessive heat for a prolonged period of time. Your cooling mechanisms begin to fail. By this we mean your body's natural cooling mechanisms. They just start to shut down and fail. The body is barely able to shed as much heat as it's generating. Alright, signs and symptoms of heat exhaustion is going to be mild to moderate perspiration. Perspiration is sweating. Warm or cool skin temperature. The skin color may be normal to pale. Weakness, exhaustion, dizziness, as well as nausea and vomiting. Alright, here's something to think about. In what situations might you expect to see cases of heat exhaustion? What can the EMR do to help prevent predictable cases? So you could see heat exhaustion anywhere. You could see it in the summer or early fall when high school kids are starting to practice football for the first times. You can see it working environments where people are working outside. The biggest way to prevent it is to give education. And if you happen to be at an outdoor festival or some type of large gathering, you want to make sure there's adequate water available. Make sure there's adequate shade. Alright, so some more signs and symptoms of heat exhaustion are going to include muscle cramps, generally in the large muscles, often in the legs. You have a rapid, weak pulse, rapid, shallow breathing. Alright, so the emergency care for heat exhaustion, you're obviously going to take appropriate BSI precautions. You're going to complete the primary assessment, ensure that the breathing is adequate. Move the patient to a cool area. Loosen or remove excess clothing. You're going to cool the patient by fanning. Be careful not to overcool the patient. Place the patient in the recovery position and provide supplemental oxygen per your local protocol. This is just an image showing a rescuer assessing an individual with a suspected heat emergency. All right, heat stroke. Temperature regulating mechanisms have failed. You're not able to rid excess body heat. Core temperature is allowed to rise uncontrolled. This is going to cause the body to overheat. A lot of times it happens very quickly. This is a life-threatening emergency. The temperature may increase to 105 Fahrenheit, which is also 40.5 degrees Celsius or even higher. Alright, signs and symptoms are going to be an altered mental status, the lack of sweating. Once you are to the point of a heat stroke, you have lost your body's natural mechanisms to keep yourself cool, so you will not be sweating anymore. The skin is going to be flushed or red, also hot and dry. It's going to be a rapid, shallow breathing and a rapid pulse. The individual is going to be weak, exhausted, and dizzy. They'll also commonly experience nausea and vomiting. Severe cases, they can have convulsions. Alright, so emergency care for the heat stroke. You're going to take appropriate standard precautions, complete a primary assessment, ensure that breathing is adequate, provide oxygen per local protocol, move the patient to a cool area, remove excess clothing. Wet the skin or immerse the patient in cool water. This can be done if you're outside and there's a water hose nearby. You can spray them off with the water hose. You can move them just into a shaded area. You can fan them with whatever object you have. You can actually place them in front of commercial fans. One thing to keep in mind though is you don't want to cool them too fast and induce shivering, because this is just going to work against you. Shivering is one of the body's natural ways to produce heat. So if they're shivering, they're producing heat while you're trying to get rid of excess heat. You can also place cold packs or ice bags in the pulse points. Biggest ones are going to be under the armpits, on the groin, or on each side of the neck. Alright, so you're also going to place the patient in the recovery position, and you're just going to monitor vital signs until help arrives. And this image just shows this rescuer fanning the individual with the clipboard. She also has them in the shade with, looks like, cool packs on the major pulse points. She's also removed majority of his clothing. Alright, here's a scenario. It's a hot summer day and you're dispatched for a man down. You arrive to find a 36-year-old male jogger who is seated on the ground. His shirt and shorts are wet from perspiration. He seems confused and has just vomited. What do you suspect? What else should you assess? How will you proceed? Okay, so we found a 36-year-old male jogger who is seated on the ground. It's a hot summer day. His shirt and shorts are wet from perspiration. He does seem to be confused and vomited. Alright, so we're going to suspect that he has some type of heat-related emergency. This could be a heat exhaustion or a heat stroke situation. Just keep in mind that just because somebody's shirt and shorts are wet from perspiration doesn't mean they're still actively sweating. This could be before they progress into heat stroke. So we can't necessarily rule out a heat stroke just because they have sweat on their shirts. You want to assess the skin. Make sure you're taking a good look at that skin. That'll tell you a lot about their status. Alright, we're going to proceed by starting to actively cool the patient. I would suggest we're going to start by removing excess clothing, fan them, and move them to a shaded area. Cold emergencies. All right, hypothermia. This is a situation that the body loses heat faster than it can be generated. Young children and the elderly are more susceptible to this. The blood is shunted from the extremities to the body's core. This is going to be to protect the vital organs. So children and the elderly are more susceptible to hypothermia. This is because, especially the elderly, they're going to have less subcutaneous tissue and they're going to lose heat faster and have less mechanisms to maintain their body temperature. With children, it really comes down to a larger surface area proportionately. They just have more surface area exposed to the environment, and they're will more quickly lose body heat as well. All right, signs and symptoms of hypothermia. It's going to be cool or cold skin temperature. They will most likely be shivering. An absence of shivering is a late and bad sign. They will probably have an altered mental status, abnormal pulse, lack of coordination, muscle rigidity, impaired judgment, complaints of joint muscle stiffness. Just keep in mind that a lot of these are similar to somebody who has consumed a large amount of alcohol. So if you've got somebody, you need to just do a full assessment and look at the environment that they're in. Also, something to take note of is some victims of extreme hypothermia are known to become confused and perceive that they are actually feeling overheated. This will lead them to remove their clothing, and this will just speed up the process of hypothermia, and it'll make it a more severe case. This is figure 17.3. It's going to be in your book. It just describes signs and symptoms of hypothermia. I'm not going to go through every single sign or symptom here. We've already been through them in previous slides. All right, emergency care for hypothermia. You're going to take appropriate BSI precautions. You're going to complete a primary assessment, ensure adequate breathing, administer oxygen per local protocols, remove the patient from the cold environment. Do not allow the patient to walk away or exert themselves in any way. Protect the patient from further heat loss. Remove wet clothing and place a blanket over and under the patient. Handle patient gently. Monitor vital signs. Do not give the patient anything to eat or drink, including hot coffee, tea, or alcohol. Alright, so considering the different methods of heat loss, why do you think it's important to remove wet clothing? Alright, so if you've got wet clothing, one of your primary ways to lose the heat is going to be through conduction. You've got direct contact of the body with the wet clothes, and this is going to pull the heat directly out of this body. Alright, so severe hypothermia. The patient is generally going to be unresponsive with skin cold to the touch. You cannot assume the patient is dead. You want to assess the pulse for 30 to 45 seconds. If there is no pulse, begin CPR. Alright, so this goes against what we learn when we're assessing somebody to determine if they need CPR or not. If you've got somebody in a very cold environment, you're going to feel that pulse and feel for it for at least 30 seconds. Sometimes somebody that has had a severe hypothermia incident will have an extremely low pulse, and you may have to feel in the spot of the pulse for longer to actually be able to palpate one. So the patient will not be pronounced dead until the core temperature is within normal range. Good rule of thumb for this is a patient is not dead until they are warm and dead. So we will always transport this patient. We'll get them to an emergency room where they can get their core temperature up to an acceptable level before we can say that they're dead. All right, localized cold injuries. This includes frostbite. It's going to be freezing or near freezing of a body part. It's caused by significant exposure to cold temperature below 0 degrees Fahrenheit or 17 degrees Celsius. So it's generally going to occur in the extremities, fingers, toes, ears, nose, and face. Early signs and symptoms are going to include numbness or tingling to the exposed area, a slow or absent capillary refill. The skin will remain soft. If thawed, tingling and pain will be present. This is an image showing the early frostbite. Late signs and symptoms are going to be white, waxy skin, firm or frozen feeling upon palpation, swelling, blisters. If thawed, this is going to become flushed with areas of purple and blanching. So we all know what purple is, and blanching is going to be white. This is the image of late frostbite. All right, emergency care for a cold injury. You're going to take appropriate BSI precautions, complete a primary assessment, ensure adequate breathing, remove the patient from the cold environment, remove wet or constrictive clothing. Manually stabilize the extremity or affected part. Cover the affected part. Do not rub or massage it. Do not re-expose it to the cold. You're going to have a late injury. You're going to remove the jewelry from the injured part. Reason you want to go ahead and remove jewelry is because you're going to experience swelling in that injured part. If you get it off early, it'll just be better in the long run. To cover the injured part with dry, sterile dressings. Place the dressing between the fingers and toe before you cover them. Do not break any blisters that may be present. Do not rub or massage the injured part. Do not apply heat. Do not attempt to rewarm. If it's involving the legs, do not allow the patient to walk. All right, this is just some different stages of cold-related emergencies. This image shows active rewarming. We've got the patient's affected extremity in a bucket of probably lukewarm water. Now, you respond to a water-filled quarry on a hot, sunny day where a couple has been scuba diving. You find a 47-year-old petite female in a wetsuit. She is confused and complaining of joint pain. Her husband reports that the water is warm at 72 degrees. They had been in the water for about an hour. What do you think might be going on? All right, so normal body temperature is 98.6. 72 degrees is significantly lower than 98.6. You don't have to be in freezing water to experience hypothermia. Anytime that you're in an environment that is colder than your body is going to actively lose heat to the environment. Even though she had on a wetsuit and the water is only 72 degrees, she had been there for an hour and she could possibly be experiencing a hypothermia injury right now. Bites and stings. Alright, so signs and symptoms of a localized reaction. You're going to have a noticeable puncture marks on the skin, pain at or around the injury site. You're going to have redness and itching at the injury site. Alright, so some dangerous things that we've got here in Georgia are, the number one is probably going to be poisonous snakes. You've got rattlesnakes, copperheads, water moccasins. You've also got a lot of poisonous insects. You've got bees, spiders. They can all have different types of reactions, but you're going to treat them all generally the same aside from the snake bite. Alright, you also experience weakness, dizziness, difficulty breathing, headache, nausea, altered mental status. Alright, so why do you think somebody that's experienced a bite or a sting may have difficulty breathing? A lot of people are allergic to different animal bites, especially bees. They could be having an anaphylactic reaction, which can in turn cause difficulty breathing. Alright, so this is the reaction caused by a brown recluse spider several days after the initial bite. Alright, so treatment, you're going to take appropriate BSI precautions, perform a scene size up, complete the primary assessment, ensure adequate breathing, administer oxygen per local protocols, scrape away bee and wasp stingers and venom sacs. Do not attempt to pinch or pull out the stingers. Use a plastic credit card just to rake it away. There's an image of how to do this on the next slide. Place a cold pack over the injury site. Alright, so it's important not to pinch or try to pull out the stingers because there's generally a venom sac attached. If you squeeze it, you can just inject more venom into the individual. Picture shows you how to use a credit card or some other plastic card to just rake the stinger away from the skin. Alright, anaphylactic shock. This is a life-threatening emergency. It's a severe allergic reaction. Common causes include bee stings, food allergies, inhaled substances, dust and pollens, certain chemicals, medications. Signs and symptoms include burning, itching, hives or rash, difficulty breathing, rapid, weak, or absent pulse, cyanosis of the lips, swelling of the face and the tongue, restlessness, changes in mental status. Alright, so what's the big deal about if the face and tongue start swelling? Alright, so what's the most common cause of airway obstruction? It's the tongue. So if your tongue starts swelling, it's going to be more likely to cause the airway obstruction. Alright, so emergency care for anaphylactic shock. You're going to follow the same procedures as you would use for standard shock. Follow your local protocols regarding assisting somebody with the epinephrine auto-injector. Always call for medical direction before assisting patients with their medications. Alright, snake bites. You're going to have a noticeable bite to the skin. You're also going to have pain and swelling. This pain and swelling may not be there right away after a bite, so you can never assume that just because there's no pain or swelling that it was a dry bite or a bite that did not inject any type of venom. Patients also generally going to present with a rapid pulse, labored breathing, weakness, vision problems, nausea, and vomiting.
As a venomous snake bites, the fangs penetrate the skin, and the venom sacs contract and cause the venom to be injected. At the local level, this leads to increased blood vessel permeability and leakage of plasma into the tissue spaces, causing swelling, blistering, and tissue necrosis. Systemically, circulation of the venom in blood and lymph may result in coagulopathies and many CNS effects, including respiratory depression and renal.
Alright, take appropriate standard precautions, perform a scene size up, complete primary assessment, ensure that breathing is adequate, locate the fang marks, clean the site with soap and water, remove any rings, bracelet, or other constricting items that may be present. Again, you want to do this because there's going to be swelling. If you get it off before the swelling occurs, it's going to be better for the patient in the long run. Keep the extremity immobilized, provide supplemental oxygen, provide care for shock, monitor the patient's vital signs. Do not apply a cold pack unless directed by a physician. Here's a scenario for you. You respond to a golf course for a 62-year-old male complaining of left ankle pain. Upon arrival, you learn the golfer tried to retrieve a ball in the woods and felt a sudden sting. There is an obvious puncture with redness and he is beginning to have trouble breathing. How do you proceed with assessment and care? Alright, water-related incidents. Alright, before we get into this section, I just want to take a moment and make a point that this chapter is just a review of water-related incidents. It will not adequately prepare anybody to perform a water rescue. If you don't know and you don't have adequate training involving water rescue, you should not attempt it. Don't be a hero. You can create yourself as another victim and cause more and more people to be put at risk trying to save you as well. Alright, so let's get started with drowning. Respiratory impairment from submersion in water or another liquid. You can have an airway obstruction, water, foreign matter in the airway, or also a swollen airway. Cardiac arrest, usually related to respiratory arrest. You can have head and neck incidents are very common.
After submersion in a liquid, Initial hyperventilation and gasping is followed by voluntary apnea and a variable degree of laryngospasm, which serve to prevent aspiration. Hypoxemia develops, a loss of consciousness follows, and developing acidosis eventually results in asphyxiation and cardiac arrest. Cessation of laryngospasm and attempts at ventilation at any time may permit water to enter the lungs. About 10 to 20% of victims maintain tight laryngospasm until respiratory and cardiac arrest, resulting in a dry drowning.
All right, look for fractures, soft tissue injuries, internal bleeding. The water does not have to be very cold, and time in the water does not have to be very long for hypothermia to occur. So as far as gaining access to the victim, do not go into the water. If the patient is close to shore or a pool side, attempt to reach and pull from the water. Use a branch, fishing pole, oar, stick, towel, shirt, or any other article of clothing. Never offer your hand, because if you give them your hand, they may panic and pull you in with them. Alright, secure your position so you will not be pulled into the water. You can throw objects towards them that will float. Throw flotation devices generally need to be attached to the line. This figure 17.7 just shows an individual using different techniques to try to rescue someone. Alright, care for patients that do not have suspected neck or spine injuries. Complete the primary assessment. Initiate mouth-to-mask resuscitation. Check for airway obstruction. Provide CPR if needed. Alright, this is going to be care for the patient with no neck or spinal injuries continued. If the patient is breathing, perform a patient assessment and control any external bleeding. Cover the patient to conserve body heat. Remove wet clothing to minimize heat loss. If the patient can be moved, take them to a warm place. Do not allow patient to walk. Place in a recovery position. Handle gently at all times. Alright, so this is care for the patient with a suspected neck or spine injury. Want to turn the patient face up in the water. Start your primary assessment. Provide rescue breathing. Float patient to shore while providing back and neck support. When the patient is out of the water, attempt resuscitation. Check for and control serious bleeding. Again, if you are not trained to rescue someone from the water, do not enter the water. Wait on appropriately trained personnel to arrive. Alright, this is water rescue. It's going to be adapted from the American Red Cross swimming and diving. If you'll just take a few minutes and look at this chart. Alright, submersion injuries. These are going to be associated with scuba diving, decompression sickness. Nitrogen bubbles in the bloodstream are called the bends. Common symptoms of decompression sickness include dull, aching pain in the joints, typically a slow onset of 1 to 48 hours to appear. Decompression sickness continued. Mild to moderate signs and symptoms. You're going to have general fatigue, pain to the muscles and joints. This is known as the bends. Numbness or paralysis. We have choking, coughing, or labored breathing. Mild to moderate signs and symptoms are going to include chest pain, collapse and unresponsiveness, blotches on the skin, or mottling. This may change in appearance. Alright, so signs and symptoms of decompressive sickness may not appear until 1 to 48 hours after diving. Why is this important for the EMR to know? It's always a good idea to ask somebody when the last time they had been diving was, if you suspect this may be a diving related injury. You just want to be aware that just because they didn't just get out of the water doesn't mean they can't be suffering from this type of problem. Alright, so some more severe signs and symptoms of decompression sickness are going to be personality changes, distorted senses, blurred vision, chest pain, numbness and tingling in the arms or legs, weakness of one or more limbs, frothy blood in the mouth or nose, convulsions. Emergency care for submersion injuries may require immediate transport to a hyperbaric chamber. Provide treatment for shock. Provide oxygen per local protocol. Place in a recovery position in a slight head down position. Alright, this is just showing that for scuba accidents, position the patient head down. Main reason for this is so you can prevent the accumulation of nitrogen bubbles in certain areas of the body. You respond to the city pool for a 16-year-old male drowning victim. He is unresponsive, breathing, has a pulse, and his skin is cold to the touch. What other injuries or conditions are you concerned about at this point? How will you proceed with the assessment and treatment? Alright, so you respond to city pool for a 16-year-old male drowning victim. He is unresponsive, he is breathing, and he has a pulse, and his skin is cold. What other injuries or conditions are you concerned about at this point? Alright, so he's got a pulse, he's breathing. He's also unresponsive, so we want to maintain his airway. Make sure we're keeping that open and clear. One thing we want to consider is he's possibly got some type of hypothermia going on, so we'll treat him accordingly. Ice-related incidents. Alright, unless trained to work on ice, do not attempt to rescue. A major problem is generally reaching the victim. Never attempt to ice rescue by yourself. Never go onto ice that is rapidly breaking. Throw a line to the victim or reach out with a stick or a pole. Throw anything that will float. Ice rescue requires special training, protective clothing, rescue equipment. Broken legs and hypothermia are common problems. Do not attempt to actively warm a severely hypothermic patient. Always activate your EMS system. This is just a image of a safe ice rescue. This requires teamwork and specially trained responders. What injuries or illness might show up immediately in incidents involving cold water and ice? The biggest ones you want to look at is going to be a hypothermia injury. You also may have trauma associated, generally to the lower extremities. How can an EMR anticipate this and provide proper care? So you obviously want to assume if they've fallen into water that has ice on the top of it, that the water is cold. You just need to anticipate what their signs and symptoms may be and be prepared to treat them accordingly. Alright, the body loses heat through radiation, conduction, convection, evaporation, respiration. Alright, hyperthermia. Hot, humid environment may cause body to generate too much heat, creating abnormally high body temperature. Signs and symptoms of hyperthermia include cramps, excessive sweating, rapid weak pulse, generalized weakness, sudden and sometimes severe muscle cramps, often occurring in the legs, heat exhaustion. It's going to be prolonged exposure to heat. It creates moist, pale skin that may feel normal or cool to the touch. Heat stroke is prolonged exposure to heat, hot and dry, or possibly moist skin. Altered mental status, rapid breathing. This is a life-threatening emergency. Emergency care for heat emergency includes removing patients from the hot environment, cooling them with water, and fanning them. A rapid heat loss creating state of low body temperature is hypothermia. You can have a cool skin temperature, shivering, and a decrease in mental status. A lot of times they'll have a stiff or rigid posture. They'll have poor judgment. Temperature does not have to be below freezing for this to occur. Frostbite is a localized cold emergency. Freezing or near freezing a part of the body. Feeling of cold followed by pain, numbness, or tingling. Emergency care is going to include removing the patient from the cold environment, removing wet clothes, keep the patient calm and warm, stabilize any cold extremity. Care for injected poisons other than snakebite. You treat them for shock, scrape away any stingers or venom sacs, place ice bag or cold pack over the area. Keep the patient calm and lying down. Clean the site. Keep bitten extremities immobilized. Alert dispatcher. Care for shock. Anaphylactic shock or allergy shock. This is a life-threatening emergency. Allergic reactions affect the respiratory and circulatory systems. Signs of anaphylactic shock include burning or itching, hives, difficulty breathing, rapid weak pulse, swelling of the face and the tongue, cyanosis, altered mental status. So care is going to be the same as other cases of shock. You transport the patient to the hospital and care for them according to protocol. Ask the patient about allergies during your patient interview. Look for a medical identification device. Many submersion injuries related to scuba diving and result when a person ascends too quickly. The bends results when tiny gas bubbles form in tissues, causing pain. In severe cases, these bubbles can form air embolism that obstructs blood flow, resulting in death. Alright, this is going to be the end of Chapter 17. If you guys have any questions, please reach out to me.
Impairment or collapse.